All right, so in radiography, okay, that's medical imaging. There's a way we actually classify patients. So we classify patients, and it's not only in radiography. Do you understand? Generally, in a hospital setting, you classify patients based on the ones that need some specialized care or they need care immediately. They also classify patients based on the ones that even if you leave them, they can be managing. Okay, so this is always useful in a scenario where maybe patients are so much, and you have to actually rank patients so that you know the ones that are going to attend to them immediately. So we have what is known as emergency patients and the non-emergency patients. So this is basically to cater for the patients, okay, and this helps in the workflow. So emergency patient just simply means a patient that require immediate, if it's in a general hospital setting, you say that immediate care. But as we're talking about radiography now, we'll talk about immediate imaging and the rest of it. Maybe the patient has trauma, acute chest pains, stroke patients, severe respiratory distress. So workflow so that the imaging is prioritized and performed immediately. It's often done in the emergency department. So they usually use any imaging modality that can be able to move, all those portable ultrasound, mobile x-rays, and the rest of it. So you should know that you are dealing with a patient that probably might not be uncooperative or might not be unstable because maybe the injury is too much for them to bear. The non-emergency patients are just calm patients. You can just even say that okay, your imaging will be like in a month's time, in 1 week's time, all this kind of thing. So mainly maybe for follow-ups, for screening tests. Maybe they want to do an imaging before a particular operation. Maybe the patient is already receiving treatment, but you just want to be monitoring how the patient is recovering. So workflow is mainly, most of the times the imaging is not emergency, so they usually schedule it. So the radiographers, they have time to prepare, make everything available, but emergency is more of like a rush work. You don't really have time for preparing and all of that.